Pflugerville Fire Department provides both fire and EMS services to include BLS and ALS first response, as well as transport services. The district began providing transport a little over 3 years ago. Currently, the district operates 5 ambulances, that's one at each of its 5 stations, and also maintains 3 ambulances in reserve for when a frontline apparatus needs repair or maintenance. All firefighters within the district are emergency medical technicians, with many being paramedics, the highest level of certification. Fire service-based EMS systems are strategically positioned in the community to deliver pre-hospital emergency medical services that incorporate time-critical response and effective patient care while maximizing community value. Fire service-based EMS emphasizes responder safety, competence, and compassionate workers, and also cost-effective operations.
I'm A.J. Stacer, Battalion Chief with Pflugerville Fire Department. I've just over 20 years, and I'm also currently serving as the EMS Battalion Chief. As a shift commander, my duties are general oversight of all operations that go on for all 911 services, whether it be fire, EMS, any type of problem solving, interactions with the hospitals, with the public, with the media, anything that needs to be done. Another role that I am currently fulfilling is the EMS Battalion Chief, which is oversight of all of the EMS operations that go on. We run a fleet of ambulances here at Pflugerville Fire Department. It's quite a complex process of EMS supply, relationships with hospitals, ensuring that our folks are trained up, have the current credentials, medications are appropriate, ambulances are stocked right, and the supply chain is robust, especially in this world we're living in today. It can be quite a challenge. There are multiple components to the EMS system, starting with the medical director. We operate underneath the medical director's license. The EMS Battalion Chief and the quality management personnel will work with the medical director to establish protocols that we treat folks in the field with, make sure that it meets all the recommendations from the medical director, and as well as what is currently appropriate in the medical field. The fire chief also must approve of those. And then it's the EMS Battalion Chief's job at that point to make those protocols a real thing and to be able to implement that in the field and work with the training division, with our quality management personnel, and begin to train our folks to that. Quality management is an integral part of our system. It verifies that what we do in the field is what we say that we're doing. We have Richard Strohacker that works with us, and that is his full-time job, just to make sure that our reports and the treatment that we are giving to our customers and our patients is appropriate. It drives training. At that point, anything that is found within quality management goes out to our EMS field trainers, and their only job is to go around and train our paramedics and our other EMS personnel to ensure that our customers are receiving a quality product that they deserve and that we are telling them that we are doing for them. Continuing relationships with our healthcare facilities is an important part of what we do. A large part of our day is transporting our customers and our citizens of our community to various hospitals, and we have to ensure that we keep good communications. They can let us know how well we're doing, we can let them know how well they're doing, and it makes these transitions very easy, and it ultimately leads to the best customer care. I think a lot of what we do in the field, I would term as emergency social work, meaning that it's not just 911 calls, it's not just people that fall and hurt themselves. A lot of times what we see in the field is we see people that are hurting for a lot of reasons that we can't actually fix in the field. But what we can do is we can help those people begin to seek the treatment that will actually get them definitive care for what they need. So a lot of what we do, and it's not unique to Pflugerville, it's just the industry, is emergency social work. We are always looking for county resources, local health resources. What can we do? How can we best operate? And how can we introduce our patient or our customer, if you will, to the best care for them, no matter what it might be? This is a relatively new part of EMS for us, and it's been a challenging and very rewarding period of the last few years. Pflugerville Fire Department's EMS system is somewhat unique in the fact that we got to study our EMS needs for 15 or 16 or more years and really look and see what the needs were. We saw what was available. We looked at numbers. We looked at what our customers' expectations were. We looked at what national standards were. After quite a few years of trying to maximize what we had available, we decided that the most appropriate thing to do was to branch out and make our own EMS system. So throughout 2016, we put together a system, worked with the state. It was a multi-month process, and we established our own EMS system. At the time we did that, we were struggling to have 2 ambulances in district from another third party. We're very proud to say that within just a few years that we now run a minimum of 5 ambulances every day. We actually own 8 licensed ambulances, so if we get busy, we can stand up to 8 ambulances. So we know that we have increased tremendously our district's availability for emergency services on the EMS side. Being the medium-sized fire department that we are, that's very busy, it's very dynamic. We run paramedic schools, we have all sorts of education elements. Again, we have ambulances, we have fire trucks. We've more than doubled in size in the last few years. You know, we're a new system. We're only 3.5 years old at this point, and we look forward to having further decades more of dynamic movement, fixing things where we need to, and patting ourselves on the back for the things that we know we're doing right.
I am Richard Strohacker. I am the QM, or Quality Management Coordinator for EMS here at the department. I've been here for about right around 4 years. I came to the department. I had heard the department had a great reputation for training, and it was something I was very passionate about. And so I took advantage of an opportunity that came up, and they offered me a position. It's been very interesting ever since. So I started my career in EMS in 2002. I became an EMT as I was coming out of high school. I was kind of conned into it by a friend that wanted to do it at the time, but it became very interesting to me. I became a paramedic in 2006. And not the entire time since then have I just been doing EMS, but I've also pursued an engineering degree and then a fire science degree after that. And along the way just decided that EMS was very interesting to do, and it was something where you could really help people. So one of the first things that I did whenever I came to Pflugerville, we were changing medical directors at the time. Dr. Zimmerman was coming in, and so we had to develop protocols. What do we do when a patient presents with a certain illness, disease, injury? And so as we were developing those protocols, it was neat to get to put those together in a way that that was also practical, while still providing the maximally aggressive care that we could for the patient. How can we help the patient, but still, not have our head too much in the clouds, and do what was practically right at the time. So developing those with Dr. Zimmerman and the help of a few paramedics that were already here was pretty interesting. Some of the more uncommon but outstanding features of the district is the realistic focus on what we actually do. So the fire department realized that we do mostly EMS, and so I put a lot of investment into the EMS side of it and developed it to where we went from having no ambulances of our own to having 8 of them in 4 years' time, and having 2 ambulances, 1 to 2 ambulances available in the district, to having 5 of them on full time and available to serve the needs of the citizens in our district. So that focus on refocusing our efforts on what we're actually doing. And it plays in also to taking an honest look at how we're doing what we do. Are we doing it correctly? Are we efficiently utilizing resources, to maximize the value for the community? Are we doing everything that we can be doing realistically for a citizen in our district who is having a crisis that particular day and time? So taking a hard look at that and adjusting the system where needed and retraining where needed.
Hi, I'm Dr. Mike Zimmerman. I'm the medical director here for Pflugerville Fire Department. My background is a degree in biology as an undergraduate. Then I got a master's degree in physiology immediately after college. The goal was always to go to medical school. After that, I was lucky enough to get into Loyola's Stritch School of Medicine in the Chicagoland area. So I spent 4 years in medical school there. It was during my time in medical school that I decided that I was interested in emergency medicine. And it was during my last year of medical school that I had a rotation in emergency medicine at the University of Chicago, which is one of the oldest and most respected emergency medicine residencies in the country. I was lucky enough to get a rotation there, did it, and that's when it really solidified my desire to go into not only emergency medicine, but to train at the University of Chicago. One of the unique things about that program was we were required to fly in helicopters, so we were flight physicians, which was one of the best parts of that training program, in addition to all the crazy inner-city pathology that we saw. After residency, my wife and I decided to stay in the Chicagoland area. I took a job at a level 1 trauma center that trained residents. That's where I spent many years. During that time, I still missed flying, so I actually would drive 2.5 hours to Madison, Wisconsin, where I had a part-time job flying on their helicopter. I did that for a number of years. As time went on, I was asked by some folks in my group who had a relationship with probably the largest private ambulance company in the Midwest to help them start a helicopter EMS program, which I did, and I was their medical director for 7 years, which was a lot of fun as well. During that time, my work also brought me to other places in Wisconsin. I was the medical director for several smaller fire and EMS groups, so I had my hand in EMS for a number of years, not only from the helicopter side, but from the fire and EMS side. We provide prompt, appropriate care to our local communities and transport our patients to the closest, most appropriate hospital. We're part of our local community, but we're also part of a much larger community that sometimes extends way beyond the borders of ESD2. We plan and train for many different scenarios, from the local single car accident to much larger incidents that may happen that involve not only the local community, but certainly regionally as well. These can be any kind of disaster, be they natural disasters or man-made disasters. Our EMS system is an integral part of our local healthcare system. For many hospitals, the emergency room now is the front door to the hospital. Most of the patients seen and cared for and ultimately admitted to the hospital come through the emergency room, and many of our patients actually come through the ER via EMS. We're a key component of this system in many ways. We are the first on the scene. We do initial evaluation, we stabilize, and we transport again to the most appropriate hospital. In addition, we alert our hospital partners, letting them know that we have patients coming in, sometimes giving the emergency physicians like myself precious minutes to prepare for whatever may be coming in, be it a heart attack, a stroke, a trauma, or otherwise. Pflugerville Fire Department is a modern, dynamic EMS service. We're constantly training, learning, and trying to improve what we do. We strive to deliver high-quality, prompt, appropriate care to all of the members of our community, and we try to do that on each and every one of our calls. I often tell our EMTs and paramedics that every day they come to work, they should try to do a little bit better than they did yesterday. There are many, many things that make our district unique, but I'll talk about just a couple of them. Our district here is growing with the community and with their needs. We have a vibrant, wonderful group of people here who are striving every day to do the best they can for our community. We also have a tremendous focus here on health and wellness of our professionals. We strive to keep them not only healthy and fit, not only psychologically, but physically as well. We would love it if all of our providers wanted to stay here and finish out their careers here at Pflugerville Fire Department. Probably the last thing that makes us very unique is our education program. We educate and train every day we're here. So my experience working as a medical director here at Pflugerville has been very rewarding. I'm truly privileged to work with really an amazing group of people here, from our big chief, Ron Mollenberg, all the way down through the management structure, many of whom you're going to meet on these videos, all the way down to the individual firefighter, EMT, and paramedic. I work with a very smart group of forward-thinking people who get up every day, try to do their job a little bit better than they did the day before. They take care of each other, and they go out there every day to serve our local community here. Every call we run, whether it's at 3 p.m. or 3 a.m., we get out there every day and do our job quickly, efficiently, safely, with kindness, compassion, and we provide excellent care for our community. So our EMS system has multiple roles in our community here. We're there to respond 24 hours a day, 7 days a week, 365 days a year, to respond to any of the medical needs that our local community here may have, and the community surrounding us as well. We're here when you might be having the worst day of your life.